Dr. Ge Ghali is the chancellor at LSU Health in Shreveport and the dean of the School of Medicine. Dr. Ghali, how are you this morning? Thanks for taking time with us.
Good morning, guys. How are y'all?
How disappointed are you? The House passes the budget. It looks like hospitals they're claiming could forced to be closed. Is that really accurate?
That's correct.
Alan Seabaugh just told us that LDH got $9 billion 2 years ago, and this budget has $13 billion. It's the way they're allocating the money. You agree with how he comments on that?
Well, I mean, Representative Seabaum's correct in the fact that, there's been an increase in allocation to LDH. There's been an increase in expenses and an increase in programs. I mean, the bill that is currently, Aaron, the bill that is currently passed the House and now is going to be put forth to the Senate completely, pretty much defunds health care to the safety net hospitals, all the public-private partner hospitals in the North and the South, as well as graduate medical education. The big issue is that graduate medical education in Louisiana is very, very tied to the funding of the public-private hospitals. So if you look at our particular case in Shreveport, we have an operating budget just for the health science center, not including the hospital, a little over about $300 to $320 million. Of that amount, nearly half of that operating budget comes from services that we provide, that the residents, the fellows, and the faculty doctors provide at the University Health Hospital. So 50%, about 55% of that. And if they cut the funding to the University Hospital, then we're looking at a 55% reduction to our operating budget. And that's just not sustainable. That's not sustainable.
If Representative Seabaugh's point, I think, was that if LDH got $9 million a couple of years ago,
$9 billion.
Or $9 billion, I'm sorry, and is this year's getting 13, and it wasn't crisis panic button time 2 years ago, why is it now?
Well, I don't know. You'll have to ask the legislature. They're the ones that work with the Louisiana Department of Health to allocate the money. I'm telling you that it's an embarrassment when higher education, or in this case healthcare, is not supported in the budget at all. It's just not supported.
What kind of message is this sending?
It's a terrible message, Aaron. Look, we're never going to have problems getting students to any of the two LSU medical schools, because we're talking 3,000 people applying for 150 to 200 positions at each institution. We're never going to have a problem getting people quantitatively to apply to medical school and to stay in Louisiana. But we're going to have a problem qualitatively, because who's going to send their child to school when there's always a question of whether it's going to close or not? And we're losing some of the best and brightest people to outside the state.
We've also spoken this morning with State Representative Larry Bagley, who said that yesterday's the budget that passed the House, he said it's part of the process, and that he thought the solution there was a lot easier and simpler than people were implying. Do you think do you see that? Do you see his point? Is he right?
Well, he may be right that it's part of the process. Representative Bagley may be right about that, but it's part of a wrong process. I mean, think about this. Every single year, we're looking at cuts, and every single year they ask me, okay, what are you going to cut? What do I cut? Do I cut the trauma center? Do I cut the burn center? Do I, cut, a particular research program, the cancer center? I mean, these are all essential programs for our citizens in North Louisiana and for the whole region. If it is part of a normal process, it's an unacceptable process. Something has to change, because it's demoralizing to the students, to the faculty, and frankly to the patients as well. They get concerned. What do we do? Do we finish up our cancer treatment in Houston or in Dallas.
The budget that came out of the Appropriations Committee, the House Appropriations Committee, and I guess which was basically the budget they passed yesterday, that TOPS seems to be the most important thing, that we're going to fund TOPS to the expense of a lot of other really important things. Do you feel that way? Do you feel like you're taking a back seat to the state scholarship program?
Well, we're, in healthcare and in medicine, we're all about education. And I think TOPS is important. I think it needs to be restructured. I think, there's some issues within TOPS that need to be restructured, but I have no ill will toward funding TOPS. I think it's an essential, great program, but I do think it needs to be tweaked a bit to get the best out of it. Now, I will tell you that do we feel we're taking a second seat? Well, I feel, constitutionally our state has an issue, with the fact that the only two things you can cut are higher ed and health care. I mean, those are the two things that everybody should be allowed to get, and those are the two things that are on the chopping block all the time. But no, I don't think we're taking a second seat. I think we're taking a bad seat. I think it needs to be fixed to where we don't have to go through this every single year. It is just unacceptable, and I can tell you the governor doesn't think this is funny at all. His response to me is, what is funny about potentially closing the school or potentially closing a hospital? It's not funny, and it really sends a bad message, I think. And look, these are great people that are in the legislature. They are smart men and women. Many of them are community leaders, but it does send a bad message when here we're going to send something forward that we know ultimately the school's not going to close, and we know ultimately the hospital's not going to close, but we're not going to send a budget forward that funds either the hospital or the medical school. I may understand that, but I can tell you the average student or the parent of the average student does not appreciate that kind of posturing.
You feel like a pawn. You feel like a pawn in a big chess game.
Absolutely, and Aaron, I've received tons of emails. I can show you tons of emails that I've received from parents, concerned parents, students, and employees at our health science center. These are people that don't necessarily even live in Shreveport, but they're parents of students that are concerned, about the longevity of the health science center. We have to deal with this kind of issue.
What's your message today to university health employees and med school employees? What's your message to them today?
Well, my message to them is that we're going to continue to fight for the health science center, including the hospital. That I think that this kind of posturing is, some people may consider it normal politics in Louisiana, but it's demoralizing and it's really unacceptable. I think some, look, I pay tons of taxes. I'm not into raising taxes hugely, but I know that sometimes we have to do certain things in order to take care of everybody and take care of what we consider important. The two most important economic drivers in North Louisiana are Barksdale and the Health Science Center.
Dr. Ge Ghali, I can't thank you enough for your time. I know you're busy this morning. Safe travels getting home, sir.
Yes, ma'am. Thank you all very much.
You bet.